I do have to admit that I was a bit disappointed by your answer regarding single-payer healthcare. Since the 2009, 2010, and especially yesterday in the House of Representatives, we have seen the shortcomings of negotiating with the special interests of the insurance and pharmaceutical industries. You have expressed support for a public option, but that still forces poor and working people to compete with the wealthy and powerful insurance corporations. And I have spoken to House representatives, for example, Representative Phil Barnhart, who said that single-payer healthcare is the only solution to our healthcare crisis, but it can only be tackled on a federal level. Over the past 2 years, we have seen, in part from the Sanders campaign, the overwhelming support from Republican, Democrat, Independent voters for us as a nation to join the rest of the developed world in instituting a single-payer healthcare system that not only guarantees quality healthcare for all Americans. We have also seen evidence that a single-payer system would cost significantly less per capita than what we have now, because it would eliminate the wasteful spending of taxpayer dollars on advertising and for the pharmaceutical and insurance companies. Now, my question to you is, will you not only support, but actively advocate for H.R. 676, the bill already in the House of Representatives, the Medicare for All Act, that has 108 Democratic co-sponsors, including 3 representatives from Oregon? Thank you.
I'm not sure I can add too much to what I said, because I do strongly believe that if you want to move both public option and single payer right now, today, if you want to move it, you can walk out of here and tell state legislators you can do it without trying to get Donald Trump, Paul Ryan, and Mitch McConnell to pass a bill. I mean, just think about that, okay? Let's just kind of really get real on the legislative process. We can use what I wrote. It is law. And we can go to progressive legislators in California and Oregon and Washington. We can do it all up and down the West Coast. And in fact, by the way, under the waiver, we think they could merge their clout. So you're talking about something with a lot of bargaining power. You could do that right now. People could walk out of the hall and do it right now. Or we could say, we're going to put in a bill, and we're going to hope Mitch McConnell, Paul Ryan, and Donald Trump are for it. Now, I have enormous respect for my colleagues, and that's why I mentioned Senator Sanders was my principal co-sponsor. So I'm going to look real closely at his bill. It has not been introduced, by the way, in the Senate. I'm going to look closely at it because I respect him and his views. But I also think I'd be doing a disservice to the thousands of Oregonians who want to take on the drug companies and take on the insurance companies to not say there is a path to do it right now. And we ought to use it. We're a progressive state. And California is, and Washington is, we can use it now. Or we can hope to get a bill with Paul Ryan and Mitch McConnell. So I appreciate it.
Why not both? Why not both?
Red ticket.